Welcome to the deep dive. We all know artificial intelligence and machine learning are uh, really changing the game in healthcare,
Mm-hmm.
predicting diseases, guiding treatments. It's huge.
Absolutely.
But there's this critical challenge bubbling up: fairness and bias,
Mm.
especially in these really powerful systems.
Mm-hmm.
So today, we're diving into a pretty interesting scoping review. It looks at how we can make machine learning fairer, specifically when using real-world health data.
Right, that RWD.
Our mission to kind of get a handle on where this bias even comes from, how we measure it, and what's actually being done to try and fix it.
Precisely. And AI, ML, I mean, they're already deep in clinical practice now.
Oh, yeah.
Predicting patient risk, helping diagnose tricky conditions, often powered by these huge sets of real-world data.
Like electronic health records?
Exactly. EHRs, insurance claims data, sometimes even data from like wearables, stuff
Yeah.
collected just during routine care.
Okay. But, despite all that potential, there's this growing worry about algorithmic bias. And it's not just theoretical, is it?
Not at all.
I mean, you think about that COMPAS tool, the one used in the U.S. justice system.
Oh, yeah, the recidivism predictions.
Exactly. It was notorious for predicting higher risks for African-American offenders, even when the actual reoffense rates were similar to white offenders. It's just a stark reminder, really.
A really powerful example. And we see similar things happening in healthcare, too.
Such as?
Well, for instance, some studies found models predicting healthcare costs could be biased. They might estimate lower costs for Black patients compared to white patients, even with the same level of need.
Which could lead to them getting less care.
Potentially, yeah. Or maybe models predicting heart failure outcomes perform worse for certain racial groups or socioeconomic groups.
Wow.
And the fascinating thing is the bias isn't necessarily, cooked up by the AI itself. It often comes from these hidden differences already in the data.
So it reflects existing societal problems.
Exactly. It reflects them and sometimes can even amplify them.
So, okay, if the bias is sort of baked into the data, how do you even start to measure fairness in an algorithm? That sounds really complex.
It is tricky. It really starts with metrics. And this is where it gets pretty interesting because there's no single magic number.
Right.
Researchers use different measures. Like one is called overall accuracy equality. Basically, does the model predict equally well for different patient groups?
Okay, makes sense.
Then there's another one, equality of opportunity. Now, this one's really important in healthcare
Why is that?
because it focuses specifically on equal false negative rates. You want to make sure the model isn't more likely to miss a diagnosis or a need for treatment in one group compared to another.
Oh, okay, I see. That's...
Definitely. But the challenge is, trying to satisfy all these different fairness metrics at the same time is incredibly difficult, almost impossible sometimes.
So you have to make trade-offs.
Often, yes. You have to decide, based on the specific clinical situation, which type of fairness matters most. It's an ethical consideration, really.
That feels like a really fundamental dilemma. Okay, so once you identify these biases using those metrics, how do you go about fixing them? The review mentioned three main ways: pre-processing, in-processing, post-processing.
That's right. And pre-processing, basically tweaking the data before you even train the model, seems to be the most common approach right now. And pretty effective, too.
How does that work, tweaking the data?
Well, imagine you have data where one group is seriously underrepresented. You might use techniques like reweighing. It essentially gives more weight or influence to the data from that underrepresented group during training.
So their patterns aren't drowned out.
Exactly.
Yeah.
Or we're seeing more integration of what they call social determinants of health.
Like income, education.
Yeah, things like the social deprivation index, which captures socioeconomic factors. Adding that kind of info to the data can help the model understand context better. And studies show this can really improve fairness metrics like demographic parity.
Demographic parity, meaning?
Meaning the model's positive predictions, like predicting someone needs a certain intervention, are more equally distributed across different groups.
Okay, that sounds like real targeted progress.
Yeah.
But what are the big questions still out there? Where does the field need to go next?
Well, yeah, it's a rapidly growing field, definitely. But a lot of the current fairness applications are still a bit limited, maybe focused on just a few conditions.
So we need broader research.
We definitely need to broaden the research across way more diseases and health conditions. And importantly, we need to dig deeper into the root causes of the bias in the data itself.
not just fixing the symptoms.
Exactly. Like, are certain groups just systematically underdiagnosed in the first place, leading to less data about them? We need to understand why the data looks the way it does.
And what about just getting the data? You mentioned real-world data. Is there enough? Is it representative of everyone?
That's another huge hurdle. Access to truly diverse, nationwide, real-world data is tough.
Because it's all siloed in different hospitals.
Pretty much. Health data is often fragmented, stuck within specific health systems, which might not reflect the whole population. Initiatives like PCRNet and OHDSI, these large patient data networks are really important.
Trying to pool data.
Pool it, or use methods like federated learning. That lets models learn from data spread across different places without actually moving the sensitive patient info around. That's key to making sure models aren't biased just because they were trained on data from one specific place or group.
Right. This whole deep dive really underscores how vital focusing on fair AI in machine learning is. It's not just about cool tech. It's about getting to truly equitable, patient-centered healthcare.
Absolutely. It boils down to building trust and making sure these powerful tools improve outcomes for everyone.
It's as essential.
And ultimately, it's about building health systems that serve all people fairly, which, raises a question for you listening. As AI keeps evolving and weaving itself into systems you use every day, how will you start to critically look at the fairness and the potential biases in the information and services you encounter?